All right, hey guys, Dr. P here. I'm going to introduce you to various techniques in chiropractic. Many have gone to chiropractors before, maybe know this, but those of you who don't, who are searching, maybe we'll get one that makes you feel comfortable and shows you what we do. Now, this is called the Activator, so I'm going to introduce the Activator technique. It is a mechanical adjusting instrument. It's not as opposed to hands-on, manual, where you move things with your hands. Some people may not like that as opposed to the table. This is called a drop table. But many chiropractors use this just as their primary technique. It's been around as long as I was trained in school, so we're going 30, 40 years, probably more. Highly effective, one of the most researched techniques there is. There's various types of mechanical adjusting. Things have come through the years where there's percussors and such, but mechanical means instrument adjusting. It has 4 settings, one real light, very light for the patient. They hardly feel it, but it's great for infants, great for children, they like that. They may not like that hands-on adjusting. And we adjust patients from cradle to coffin. It's several settings, some of them are a little more intense, which has a high impulse, boom, and I'll show you here in a minute. But the important thing about this is it's a taught technique. It has its own system of analysis of the spine from head to toe, to where we find the vertebra that may be out of alignment or not in place, and we go up and set this on it and move it quickly. It's a high impulse to the joint. There's no popping and cracking or those types of words, but it's high impulse to the joint. It stimulates the brain to relax the joint, to realign it. Now, the good thing about this, it's especially for athletes, it's working on shoulders, elbows, hands, carpal tunnel, feet, tarsal tunnel, all the things that go on with the feet and knees, and it's easier on them, and you're not a hands-on adjusting. This is my primary technique. It's one of them when we see needed. And there, again, some patients like this a whole lot better than the other ones. We try to adapt that to them. So, just simplified version. There are specific points in Activator where they want you to adjust, and you apply pressure, and it's a high impulse, and you say, well, does that really do anything? You bet it does. Again, we're hitting on a ligament to make the joint move. Up in here, I've got it on level 4. I'm not going to do it much, but she would feel a high intensity to the area. And that's to realign vertebra or get the pressure off the nerves without the use of the hand. So the Activator can be a much more gentle technique that people prefer, and that's okay. We kind of ask them what they want when they're in here as they feel it. Again, for children, it's fantastic. It's a light pressure. The way you get them comfortable is you say, feel that on your finger, and they're okay with it. And elderly that can't handle manual adjusting or drop, great for them. Any age is good for this, and even some of the most burly men prefer this as opposed to getting in there and working on them in a stronger way. So Activator is very, very effective if you're not familiar with it. Again, it's a mechanical adjuster and can do just the same as hands-on. Long taught technique, one of the primary techniques taught in the schools, and there are many others, and we'll get on to other techniques here in the future. Thanks.